half-hour show that focuses on the concerns of your community. Today's topic is health issues and what you need to know. Now let me introduce you to today's guest. We're going to start out with Betty Lou Pierce, who's a wellness consultant. We also have Dr. Jimmy Steger, who's a naturopathic physician. We also have with us today Dr. Michael D. Bucknell and Dr. George Burrows. Thank you guys so much for being here. I know we've got lots to talk about today. I wanted to start with you, Dr. Steger. Tell me a little bit about what you do and how it's different from other doctors.
Well, basically, a naturopathic doctor is just one who deals in natural medicine. We don't prescribe any type of surgery or drugs. And we deal basically with nutrition, herbal medicine, homeopathic medicine. So when a person comes in, we treat them with natural modalities. And we take care of them in a way so that you don't have to worry about the harms of the medical industry with all the drugs and the things that's going on out there. So it's quite different.
I imagine it's rising in popularity.
Absolutely,
now.
Absolutely. Everybody's coming in now. About 57% of all Americans now are seeking natural medicine in some form or fashion. So between the chiropractic field and the naturopathic field, we feel that we can pretty much well handle almost any given thing that's going on in our modern day society. So we deal a lot with chiropractic physicians, and I totally support what they do and I always have. And long before I became a clinical nutritionist and a naturopathic doctor, I was working as a nutritionist actually for a chiropractic physician here in Mobile back in the early 80s. So I think that what we have to offer is something that is definitely on the rise today, and more people are becoming more aware of their bodies. They're seeking answers that they're not getting from the medical industry. So I think everybody's searching, and with the great panel we have here today, I think they're going to be behind that 100%. And tell you the same thing, you know, Betty Lou, she's been around a long time. I've known her for a long time, has a great store and a great facility. And I know that she has done such a wonderful job in the past before people like myself came around trying to help people and guide them in the right direction. So I think the future is clearly in the hands of the panel that you see here today. Naturopathic physicians and chiropractic doctors all over the country. They're flourishing, and I think the practices are continuing to grow because people are clearly trying to find out what's really going on. I think we have a lot of those answers that are just not being given to the public.
All right, well, let's get right to it, guys. In your opinion, what are the two major health issues today?
Well, my opinion would be really just not getting to the root of problems. That everything is, I think, I don't know if you can classify it as a disease, but certainly symptomology is what I classify as the biggest issue, is that everything is designed around symptoms. Everybody's looking for symptoms, and that's why drugs flourish. But if we got to the root of most problems, the research clearly shows that most of the diseases that we deal with today, they wouldn't even be around. They wouldn't be problems. A lot of the new research shows as little as 5% actually has to do with genetics. 95% is lifestyle. So if we can just change those things by doing the things that has been in use for a long time, this isn't new stuff, it's just been really overpowered and over-dollared. You know, if we just go about it in these ways, I think a lot of these problems that we had wouldn't be there.
Lifestyle changes. I've heard that so many times. We all have choices to make, and I know I don't always make the right choices. What are little things we can do at home differently so I don't have to go see you guys for help?
Well, the biggest thing probably would be diet, mainly just because that's so popular today. There's so much focus in the media, television, radio. You're hearing about how important diet is in our health. And if we do want to change the symptoms, if you would, and not necessarily treat the symptoms, but get to the root, one thing we can do at home is pay more attention to our diet. I mean, simple changes starting with what we drink. If we drink water exclusively and occasionally had a soft drink, we would see right off the bat a big change right on from our children up through adults. And then changing the content of the foods and the quality that we eat. And most people know they shouldn't eat sugar, at least not excessively. But if we would cut down on our sugar and sugar substitutes, they're really no better. They create a whole bunch of different problems. decreased the amount of processed foods, man-made foods, and got back to more of a natural fruits, vegetables. We can eat meat. Different bodies handle different things differently, but just more natural. That's something we can start right away doing at home and seeing a change in our health.
I know one of the problems you talked about earlier was diabetes. Talk about that problem today.
Yes, with the type 2 diabetes being so prevalent now, and especially in our children. And I think it's because of being hypoglycemic for so long, which is low blood sugar, which means it goes on a roller coaster. Because of what we eat and drink, it causes this. And then after a while, with the pancreas going in overload, then it goes into type 2 diabetes, which can be prevented. It never has to go to that point. And so many things are overlooked. I think it's a step with the schools taking the soft drinks out of elementary, but to allow diet sodas in high school, I think, is an abomination. I just really think it's terrible, because not only are sodas so acid that with drinking one, the body thinks you're trying to kill it and it starts drawing nutrients out of the skeletal system, but diet on top of it is even worse because of the artificial sweeteners and the harm that they can do to bodies. So, I think they're taking a step, but I think they're also taking a giant step backwards with what they're doing to our children. So it needs to be so totally revamped. And the most dangerous diet, I think, is the standard American diet. It's all acid, and it causes so many, many problems. So, my customers are always saying, well, we should have learned this in school. I said, yes, in elementary school. We should have, but we didn't, so we've got to learn it now, for our sakes, for our children's sakes, grandchildren's sake. So it's to really revamp our whole way of thinking about what we eat or drink. And I have customers who say, well, why don't you educate me along the lines of what all these things mean? I pick up things to read, and I don't know what that is in that box. And I said, put the box back on the shelf. Go over to the fresh produce section and leave those things alone. If you don't know what that word means, don't eat it. Don't put it in your mouth,
You don't have to worry about reading spinach or carrots in, because it's right there in front of you. There's no label.
Exactly.
We all know what it is.
And fresh. We don't want frozen. We definitely don't want canned.
No canned items.
It's got
correct.
hidden sugars and salts in it, so we have to leave canned foods alone completely. And I really don't suggest frozen. That's like maybe second, but definitely fresh food. So these are the things that we really need to start looking at as we gather around the table, and not scattered all over town going in a million different directions, but sitting at the table.
I know with children, it's so easy to stop by and get them those chicken McNuggets, or put a hot dog in the microwave just to pacify them. What can parents do to start with those healthy habits early?
Well, actually, if you start children off, they have an understanding. They have a knowing. Small children, you hand them a carrot stick and they'll chew on that. They learn the habits from parents. So we're handing them these things, and it's like a 3-year-old won't drink anything but Coke. Well, does that 3-year-old get in the car and go to the grocery store and buy that? How does that 3-year-old get it in his or her hand? So these are the things that I have to point out, is that if the parents will do it, they'll automatically do this for children, and they'll be healthier, and they'll grow up, and they'll have so many fewer problems.
Absolutely.
And the attention deficit will almost completely disappear.
Yeah, you didn't hear about that 20 years ago. When we were all younger, none of us heard of ADD, ADHD, bipolar manic state. This has all just come around in the last 15 years, 20 years. Why? Because of all the sugar substitutes, all the red food dyes. This is all poison, toxic. You got to get it out of their system and do exactly like Betty Lou said. Start them at an early age with nothing but fresh, organic fruits and vegetables. That child will never develop at the cellular level a taste for anything else, because the cell membranes are very smart. They pick up on this, and they know what's going in their body. They develop a taste for it. They start to crave that. And if you never have that in the sight of a child, he never knows what it's like. So that's exactly correct.
Yeah, actually, I had that experience with my children when they were small. They said they didn't want that cloudy apple juice that they had been drinking. They wanted the clear apple juice like their friends. And I said, okay, let's go to the store and get that. So we bought the clear apple juice, came home. I poured it out for them. They took one sip. and it tasted so bad.
Yeah.
They didn't want any more, and so they never complained
Big
about it
difference,
again.
that's right.
So, you know, their taste buds are just automatically going to
That's
tell them.
correct.
I think the key word you said there was pacifier. You know, and if you get your kids used to it right up front, we've got a 20-month-old. He's been eating nothing but fruits and vegetables and real food since he was young. He doesn't know what the other stuff really tastes like, and you know, so if you just get them used to it, they eat it. But when you do get, you know, you start exposing them to these other things, and that's all they get, it's an addiction. It's a physical addiction. And when you do that, then they start to shift the other way, and then they start playing us, figuring out that it's, you know, all they have to do is scream a little bit louder to get that what they want, you know, and then it just roller coasters up to that, you know, the ADHD and all these different things, because we need to be focusing on what's good for them, not necessarily on what they want.
One thing you have to remember too, in the household, if you don't have it there, they can't have it. So I go through and clean these refrigerators out on these patients of mine, and they ask me to come over and we take care of that. And I said, this is what you got to get rid of. They see it, they're going to create. If you're eating it, just like she said in the car, if it's there for mommy to drink on the front and the child's in the back seat, they're going to want what the parents have. Right. If it's not there, they won't develop that. So that's where it all starts, at a very early age, as soon as they're born.
Now, for those parents who already have their kids in those bad habits, what can they do? Like you said, it's almost an addiction. Is it too late for those kids to turn around?
Kids won't starve.
It's never too late.
Right.
You put it in front of them, they're going to eat good foods. It may take a little while, but you have to work them. You know, that was something that shouldn't have happened from the beginning, but if it is, yes, you can change them. It just takes time, and it starts with the parents.
Yes.
The parents have to start that. So I usually take the mother. The mother usually comes to me first. They're doing the cooking, so we get the mother straightened out. She brings her husband in. We get the husband on a good eating program, and they got the whole family in there. So then you take care of the whole family. Then you've changed all that, and it's important. It starts from the parents, though. You have to do that.
I agree. I see that all the time with my patients. I'll tell the parents, let your child, I know this sounds terrible, but let your child continue on that diet for now. You change your diet. You start drinking water. You give up the processed foods. They will notice the change in you. Then you can start implementing that with your children, because our actions do speak much louder than our words, and we don't want to be hypocrites. But you can't expect a child or an adult that's been trained to eat a certain way to all of a sudden change.
Right.
They're not going to. But if we have a strategy, like Dr. Steger was saying, you work with them, and you work with the adults, but it's got to start with us as parents.
And us as parents and children, shouldn't we just turn off that TV every now and then? I mean,
Absolutely. Yeah.
That has more implications than really, you know, just on the dietary aspect. I mean, just even in terms of learning, they know you have to be activating certain systems within your brain, the cerebellum, to be able to learn. Right. You can't learn sitting in front of a TV. You have to be able to move, and you know, when our thumbs are getting the only exercise, it's really hard to get that activation.
And we're definitely a program of our environment. That's correct. That's exactly right. That's why you see so many unfit kids nowadays. When we were younger, they can definitely tell we was outside running, was playing sports, was active all day. Nowadays, the kids want to sit inside on the couch, come home from school, play the video games. They all have large jaws from either chewing on potato chips or talking too much. They got incredible large thumbs. They need to develop a sense of balance, a sense of wellness, which they're not getting anymore.
and again, that starts with the parents taking that game away and turning off that TV, get them outside, throw the football around, got to interact.
And feeding them food that will give them energy to want to go out and do it. Because, you know, if your blood sugar's on a roller coaster and you're just wiped out and irritable, and, I mean, then this game, and that's about all you can do.
And dead foods create dead energy. So what she said a minute ago, that's correct. The Cokes, the soda pops in our society are disastrous on the human brain. And like she said a minute ago about the bones, it draws the calcium out of the bones because of phosphoric acid in those Cokes. Those diet sodas are terrible. So that's exactly what happens. They eat that, they get real aggressive, and you have a problem child on your hand. Then you send them to the medical institution, they go to a psychiatrist, and they put them on drugs. That's not the answer. No. Not the answer at all.
And what do the drugs do? They work on sugar within the brain.
Interesting.
And they know what, I mean, we know what is causing these issues.
That's right.
And that's exactly what they go after.
And going back to what Dr. Bucknell said a minute ago, statistics clearly show us some of the major causes in our society of ADD, ADHD, and bipolar is because of the C1, C2 in the neck being out of alignment, which is called subluxation in their field, and then their diet. So if you take and correct those two things in a child, you can watch them change very, very quickly. It doesn't take but 3 or 4 weeks. They keep going back, getting that back straightened out, letting these physicians work with them. The parents will be amazed. So many of our parents in society do not understand or have not been taught, which is what our problem is nowadays. No education. We have to educate the parents and teach them, why does my child act the way he does? And that's what it's about. But if they'll go and consider that option, just go see a good chiropractic physician and let them explain to you a little bit what's going on. You'll be amazed at how many problems we have with our cranial up here, with the eyes, the ears, the nose, the throat, these types of things, and throughout the rest of the body as well. But that, combined with a good, sensible eating program, can totally change your child, and you as well as a parent, once again, going back to that issue, so quickly. You'd be really amazed in 4 to 6 weeks what can happen to a child or an adult just by doing those two simple things.
Yeah, what about adults who are suffering from depression? Can they change their habits as well to get out of that funk?
Oh, gosh, yes. You know, and one of the things that's almost ironic living down here in the South is one of the best things for combating depression is sunshine. Mm-hmm. And we live, it's hot out here.
Yes, it is.
But most of us do not get enough sun. And I think part of it's been, there's been this stigma that the sun is bad for you, and it's not. Now, I'm not telling you to go out and
get burned.
Yeah, and get burned. That'd be like going in the gym and not having been in the gym. You go in there for 9 hours and work out. That's not that smart. But getting a little bit of sunshine every day literally stimulates neurotransmitters in the brain to combat depression. And most people are familiar in the colder parts of the country. They have a seasonal affective disorder, you know, a fancy name for depression in the winter. But if we don't get enough sunlight, then we are going to set ourselves up, back to how we started this program by saying symptomatology of depression. But that's just one simple way, is to make sure you get enough sunshine. And then wake up each morning, you know, telling yourself you're glad to be alive. You know, instead of saying, oh, good God, it's morning, say, you know, good morning, God, and go from there. And attitude goes so far with it.
That's great.
Dr. Steger had mentioned how posture is really affecting things, and they have phenomenal new research that's coming out that even identifies when you lose the curves within your spine, that it puts physical strain and stretch on your spinal cord, which affects the lower parts of the brain, which they have now linked to depression. So again, going back to posture and the way that this defines your body, a simple way that I usually talk with patients is the way that the animal kingdom works. I mean, you look at a lion going after somebody, going after a gazelle out there, who does he look for? He doesn't get their blood pressure or take their glucose levels or medical history or ask them what their grandfather died from. He doesn't do any of that. He just simply looks at them. He's looking at their posture. Okay, and that's your overall status. So if you change those things, you change those simple things, I mean, it's just, literally, there's nothing that you can't turn around, with the exception of that 5%.
You can consciously change your posture at any time. You know, you can see, like you said, in the animal kingdom, but humans walking around slumped down, you're going to feel worse than if you stand up straight, lift your head up, smile. It takes less muscles to smile than it does to frown. And, conserve energy that way. But that has a direct impact on how you feel, is how you carry yourself. And we can do that instantly. And it helps.
So many people, it seems, this day and age are suffering from depression. Do you guys feel like the antidepressants are being handed out a little too often now?
Oh, gosh. Yeah, I mean, definitely. And again, it's not, I do understand that there's times where you might be so down that you do need some medical intervention. But that should only be to help you get to the root of what's going on. And the root might be emotionally based. You may hate your job and really need to quit and look for other employment. Or it could be nutritional. People have no idea how depressed they get, even from so-called good foods like milk and wheat. For a lot of people, they don't even know they're sensitive to it, and it's driving their nervous system down, and hence the depression, and then a lack of exercise. So you've got things in the emotional realm, the physical realm, and the nutritional realm, all that can contribute. But if you need to take an antidepressant, it should be for a season, for a short period of time, so that you can explore what truly needs to be done to correct the problem and get off those drugs, because that's just heading you in a direction you don't want to be going long term.
I tell you what, the numbers are just scary. Yeah. You look up these reports that are coming out on it, and they're saying that a lot of times, because we're one of the only countries on the globe that advertises to the public in terms of medications. And there's actually organizations out there. I was on a website last night that are trying to get legislation passed to eliminate that direct-to-consumer advertising because of the damage that it's doing. Yeah. It's showing, you put into conjunction the money that doctors are getting specifically, directly from pharmaceutical companies in terms of gifting and all these different things, $8,000 to $13,000 a year per physician, according to some reports. You get these numbers, you put them all together, and what does it turn into? Patients going in, they ask for the purple pill that they saw on TV, and what do they get? They get the purple pill, or they get the next newest thing on the market.
Yeah, new improved.
That's scary stuff.
Yeah, if it was so good the first time, why is it improved?
Right.
We haven't changed Chinese medicine since the day God put it here on this earth, which is what we're supposed to use to heal the body. So that's exactly what he's talking about. They have these new improved formulas that they're always coming out with. So it's really unfortunate.
Turn into a vicious cycle.
Absolutely.
Yeah. And the side effects of antidepressants, murder and suicide.
Absolutely.
And so, it can all be so prevented. It's just like with, usually people who are depressed, you'll notice that they drink a lot of coffee with a lot of sugar. Same with people with arthritis. The pain is so bad, and they're drinking more coffee with sugar, which is constantly keeping the pain going. And same thing with depression, because those two will deplete the B vitamins in the system, which work towards healing the nerves.
Absolutely.
So if we look into all of these things, then we can see how we can push those things aside that will cause these very serious side effects. And that way the person can enjoy good health.
Just be free. Be free from pills and all that.
And people in the United States take more drugs than anybody in the whole world. And so we're number one in drug consumption, but yet we're number 37 or something like that in healthcare.
That says a lot, doesn't it?
It does.
Unbelievable. Yeah, it really is.
So
We have the best emergency care in this country. If you need something instantly, you've been struck by a car, you need some kind of immediate attention, there's no better place than the United States.
Sure.
But for these chronic conditions, which is costing us billions and billions of dollars, we fail miserably. And it's because, once again, we don't go to the cause. We keep treating symptoms. And if it was effective, we would have had a decrease in heart disease. We've had a decrease in cancer. We'd have a decrease in depression. And it's just the opposite. It's not getting better. It's getting worse. It's just not working.
That's right.
We're number one in chronic disease at this point, even though we're number one in drugs, consuming over 80% of the world's drugs. We also, if you look at other reports, some say that the U.S. medical system is the third leading cause of death in this country.
Absolutely.
Some reports say that your child has the least chance of surviving to the age of 3 in this country. 50% of births end in C-section. Just all these different things that are going on. I mean, we see them constantly in the media, but it's kind of like language. When we're exposed to it all the time, what happens? We get dulled down to it. Right. So we stop paying attention to it.
You're totally numb to it. That's correct.
Exactly. Even though these things are in the news and in the media constantly, this show, even though this stuff we're constantly exposed to, it's like we just turn a blind eye and a deaf ear to it.
But just think if we had, and this goes back to what we was talking about a minute ago, just think if this show was on 10 hours a day.
Right.
Mm-hmm. How good would that do for not only our families, our parents, which is where it's got to start from, we talked about, but for the kids? You imagine the kids sitting down watching this show? It's not going to happen. It's not appealing to the child.
They'll fall asleep.
Absolutely. The thing about it is you are a product of what you're watching on TV as well. And if every other commercial that comes on is a drug commercial, you're doing just what Dr. Bucknell said. You're running to your medical doctor and asking for this. This shouldn't be for you to ask for. A physician or a doctor should be able to tell you, you know what, you come to me, this is what your problem is, and this is what I prescribe, what I suggest for you. Instead, the American public now is running out and asking the physician,
And the
shouldn't be
physician
happening.
is giving it to them.
Right.
Because it's money coming back to them, like he said. And that's just really unfortunate that it's gotten to this point in our society. And only in the last 4 or 5 years have you seen the increased advertising on every other commercial being drug-related. So it's drugs, drugs, drugs being it just really shoved down the throats of the American public. It's really sad.
And not to mention all the addictions now with painkillers and these drugs.
Sure.
Here's the thing about it. The American public has this passion for research. We really look for research for everything. That research is our validation. And the powers that be, they know this. And this is the key tool. This is why we have gotten to this point, because everybody looks at this research and they say instantly, that's what it is. You know, this is truth. And you know, I handed you a report here today. You know, this new thing, road rage disease, intermittent explosive disorder. Yeah, I mean
Is that for real though? I mean, road
it's
rage
absolutely
disease?
for real. It's now. This is actually something that's been in the textbooks for a long time, but you know, it wasn't a hot diagnosis. So what do? This research that they do, they go out and they take a survey. Well, you know what? I mean, if you go out and take surveys and get this stuff published, I mean, why don't we all do that?
Right.
You know, because, hey, it works. People look at this stuff, and how many drugs do you think are going to be sold? Anti-anxiety medications, depression medications, maybe even ADHD medications because of this research.
And now a road rage medicine. It just seems like a big excuse.
Right.
Yeah. And that's exactly what happened. Thousands of people will be flocking in because they'll put that on TV, you know, saying if you suffer from this intermittent explosive disorder, whatever they're calling it, you know, it's exactly what they're going to do. They're going to create this drug for it, and it'll be selling nationwide in a shorter period of time, and everybody be running in saying, you know, my husband has that. I think he needs to be on that. So they'll be dragging their husbands and wives in, and that's exactly what happened. And that's not the problem at all.
No, and it shifts responsibility away from the patient. You're sitting there, whether it's intermittent explosive behavior, you know, road rage, or even the ADHD, if you are taught to believe, oh, it's not me, it's a chemical imbalance. It's nothing I'm doing wrong, it's something I inherited from my parents. And I just don't believe that. I think it takes that responsibility off of me. Oh, it's not my fault. Let me fix this problem with the drug, instead of saying, wait a minute, what's causing this in my body? What is the root?
Right.
You know, because I've never heard of a Ritalin deficiency. You know, for the ADHD, there's no such thing as a Ritalin deficiency.
Guys, I hate to cut you off. We only have about 30 seconds left. Any phone numbers you want to give for more information on this stuff, or any books, anything we could tell our viewers?
Give us a call at our clinic or go see Betty Lou. We'll all be glad to help you and assist you in the right direction, I believe. These guys are wonderful.
Yeah, we could talk about this forever. We just scratched the surface on this, so thank you guys so much.
Oh, thank you.
We'll be back.
All right, yeah, we will be. This will definitely be something that we will continue to talk about because it's so important.
Absolutely. Thank you.
All right, and for more information, you can call area code 251-380-9488. And that's all the time we have today. Thanks for joining us. Be sure to tune in next week. Until then, remember to speak up.
If you have something you want to speak up about, send us an email to speakup@gulfcoastwb.com or send us a letter to the Gulf Coast WB, 1501 Satchel Page Drive, Mobile, Alabama 36606. Attention, speak up.
What are the odds of a child being diagnosed with autism? 1 in 166. To learn the signs of autism, visit autismspeaks.org.
Back to Bake Auto Paint Collision has now been serving Mobile for over 55 years in the automotive industry. Hello, my name is Mike.